Are you ready? Well, good afternoon. Before we end the week, I wanted to provide an update to the people of Iowa on the status of our COVID-19 response. Just 5 days ago, we learned of Iowa's first positive case of the coronavirus. On that day, I upgraded the status of the State Emergency Operations Center, or SEOC, from partial to full activation. The following day, I signed a proclamation of disaster emergency authorizing state agencies to utilize all resources necessary to prevent, contain, and mitigate the effects of the COVID-19 virus. And throughout the week, we have assembled teams to address the immediate public health needs and protect the people of the great state of Iowa. We just wrapped up a 2-hour session at SEOC with leaders from several key state agencies about community mitigation strategies to reduce the risk to Iowans and contain the spread of the virus. I want to thank the leaders with me today, and especially their teams, for the incredible effort and teamwork demonstrated over the last several days. As we prepare for what's ahead, I'm confident that we have the right people in place to do the job. Today, I am pleased to share some good news. As we speak, 10 of the Iowans who were quarantined on the Grand Princess cruise in California will be home tonight, and we are working to bring the remaining 10 Iowans home tomorrow. This afternoon, we were also notified of one additional Iowan who tested positive for COVID-19. This individual was tested in Nebraska, but is a resident of Harrison County. All 22 of the tests completed today at the State Hygienic Lab were negative. That brings the total number of Iowans infected with the virus to 17. All 17 positive cases are travel-related, and 15 are directly linked to the same Egyptian cruise. At this time, Iowa is not experiencing community spread of the virus. However, we anticipate it will happen, and now is the time to prepare. This week, state agencies notified their employees about new work-related travel restrictions and guidance for personal travel. At this time, we are ceasing all non-essential business travel by state employees. We are also asking that employees speak with their supervisor and follow the guidance of the CDC regarding their personal travel. If a state employee travels to an affected area, they will be expected to self-isolate at home for 14 days before they return to work. Now is the time to dramatically reduce our risk and to slow the spread of the virus so that we can continue to mitigate it. But we must be responsible about the decisions that we make to do that. If made too soon, some decisions may have serious consequences for Iowa families, businesses, and communities. For example, yesterday, the Department of Education issued guidance for Iowa's K-12 schools. Now is the time for schools to be putting their plans in place for when community spread occurs. The Department of Public Health and the Department of Education do not recommend closing schools at this time. Please know that the Department of Public Health and the Department of Education are here to help you when the time does come, or if you have questions, don't hesitate to reach out to them. Now is the time for a measured and responsible approach. This afternoon, the President declared a national emergency and announced $50 billion in federal aid. He also asked all states to work together and to do their part to help slow the spread of the virus across the country. That's been the focus of our discussion and planning here today. We're coordinating our plans and our resources and reaching out to businesses, healthcare, and other partners to be part of Iowa's strategy to, again, slow down the spread of COVID-19. Next week, we are including leaders from Iowa's healthcare systems at the SEOC. We will meet with them to discuss and coordinate plans for resources and staffing needs in our hospitals, clinics, and other healthcare facilities across the state. But our mitigation efforts extend beyond the walls of SEOC. I want Iowans to know that they also are a very important part of our strategy to stop the spread of the coronavirus. Just like cold, flu, and other more common strains of coronavirus, COVID-19 is spread through transmission of droplets. It's easily passed from one person to the next. And because COVID-19 is a new coronavirus, our bodies don't have the immunity to it, and there are no vaccines at this time to prevent it. And that is why the virus has spread so quickly to a worldwide pandemic level. Every Iowan can make a real difference by reducing our risk for community spread. We must be vigilant about simple, common sense precautions. Wash your hands frequently, coughs, sneezes, cover sneezes and coughs, and if you have any signs of illness, please stay home. Don't go to work, school, or out in public when you could be in close proximity to others. And most importantly, if you are feeling the symptoms, we ask that you call the doctor first before going in for an appointment, and they will walk you through an assessment and help decide what are the appropriate actions to take. As you're going to probably hear Dr. Padati say, this sounds simple, but these are the steps that really will protect your health and the health of all Iowans. And I cannot stress enough that COVID-19 poses the most risk to older adults above the age of 60, and especially those with underlying health conditions such as heart disease, lung disease, and diabetes. If this describes you or a loved one, we again urge you to take extra precautions. The CDC recommends you avoid large public events and crowded places, avoid cruise travel and non-essential air travel, stay home as much as possible if there is an outbreak in your community, keep some space between yourself and others when you are out, stay away from people who are sick, and of course, wash your hands often, cover cough and sneezes, and stay home when you're sick. Finally, next week is spring break for many schools, and Iowa families will be going on vacation. Please know the COVID-19 status in the area where you are traveling. You can find the most up-to-date travel information and restrictions on the CDC website at cdc.gov. And if you are in an affected area, I urge you to self-isolate at home for 14 days, as recommended, to monitor your health and to, again, prevent the spread of the coronavirus to your classmates, coworkers, friends, and neighbors, and your fellow Iowans. Be safe and be responsible. With that, I'd like to invite Dr. Padati to provide more detail about community spread and some of the guidance issued this week by the Department of Public Health. But before she does that, I want to just acknowledge again the tremendous work that she and her team and all of the people standing behind me today have done in these past 5 days. We are very grateful and just really appreciate the job that you're doing. With that, I'll turn it over to Dr. Padati.
Thank you very much, Governor Reynolds. I really appreciate the opportunity to continue to talk with Iowans about public health, about ways to prevent the spread of this virus, and today a bit more about what we call mitigation strategies. As the case counts in our state increase, it's completely understandable that the concern would increase. It's important to keep in mind that at this point we have not yet recognized community spread here in Iowa. Community spread happens when the virus starts to be transmitted among people who haven't been exposed to a known risk factor or to a confirmed case. So in other words, this is when an individual becomes sick with COVID-19 but isn't sure how they would have gotten it. Across the country, and including here in Iowa, local, state, and federal public health disease detectives are continuing to conduct thorough investigations and follow up with contacts of each positive case. When that happens, the kind of things we're doing are asking about travel information and who somebody might have been in contact with to determine first how they may have gotten sick. We also examine whether that individual could have potentially exposed anybody else while they were sick. And anybody who is determined to be a close contact of a known case is then contacted by public health. After that, we provide advice on the next steps that they need to take to keep themselves healthy as well as their communities and families. These steps largely include limiting their interactions and putting more space between people, which is something we also refer to as social distancing. We understand that there are a lot of questions right now about what social distancing means, as well as about mass gatherings, and IDPH has been and will continue to provide guidance on this. Along with our federal partners at the CDC, we're also providing guidance for high-risk groups, particularly when it comes to mass gatherings. For example, emphasizing the restrictions around long-term care facility visits. We also want to note that older adults, again, and those with chronic health conditions should stay away from others who are sick and limit close contact, avoid crowds, and wash their hands often. We're also going to continue to recommend that event organizers prepare as well. They need to ensure that they have contingency plans in place should the need arise. We understand that this can be difficult because things have been changing quickly and they're likely to continue to change. And even with strategies in place to slow the spread of this virus, it is likely that we will see more positive cases. And as we continue to investigate these cases, if public health reveals that there's a new positive case that can't be linked to a known risk factor, like travel on a cruise or a confirmed case, this will indicate that there's spread of the virus in our community. And when we see community spread, we're going to use proven public health measures and make recommendations to help people reduce personal interactions and focus on things like social distancing. So to help slow the spread of the virus, we're going to recommend things like mitigation strategies. And so this is probably what you've heard of when you hear people refer to things like flattening the curve. The idea here is that what we're going to do is slow the spread of a virus to help limit or help reduce the likelihood of a rapid spike in cases. Slowing down and spreading out transmission of a virus is then going to allow all of our critical partners, which include people like hospital personnel, police, EMS, drug manufacturers, and more, that they have a little bit more time to help respond. It also helps keep our systems from becoming overwhelmed at once so that we can maintain sufficient hospital beds, staff, and supplies as we need them. In addition to focusing on slowing the spreading of this disease, we also want to protect our high-risk populations. Again, doing things like avoiding close contact with others and staying home when you're sick are especially important in this time before we have a vaccine or other therapeutic options available. I want to emphasize that individuals, communities, businesses, and healthcare organizations are all an important part of mitigation strategies. Each community is going to be unique, and the mitigation strategies might vary by the community, what's appropriate for them as they prepare, and whether they're experiencing community spread. Communities are going to continue to make decisions at the local level with support from state and federal public health partners. In addition to sharing more information on mitigation strategies this week, IDPH has provided detailed guidance to healthcare providers, long-term care facilities, and schools to assist in their planning should we see community spread. Depending on the level of community spread that we could see, local and state public health departments might need to implement additional mitigation strategies. And so as you heard, going forward, we're going to continue to closely follow contact tracing of these cases to understand the spread of this disease. IDPH also continues to maintain an extensive call center operation that's going to include our disease detectives or epidemiologists who are providing support to public health and clinicians throughout Iowa. We also have a call center, as you've heard, for Iowans who have questions. This is our 211 number that allows Iowans to call in and get basic information about COVID-19 and where to learn more. Our operators will talk with Iowans about items such as what COVID-19 is, how it's transmitted, and what they can do to protect themselves. We want to encourage the public to stay tuned to messages from public health. We're updating our COVID-19 webpage at IDPH throughout the day and providing frequent news releases and briefings. And as I say each time I get the opportunity, whether it comes to seasonal flu or now COVID-19, we really want to encourage Iowans to stay home when you're sick, cover your cough, and wash your hands. We all have a role to play in reducing the spread and impact of this virus. Our number one priority is to reduce the impact of this virus here in Iowa as much as possible, and we're going to continue to work toward this with our many partners at the local, state, and federal level. Thank you.